Alright, let's talk about renal cell carcinoma. In renal cell carcinoma, we will see polygonal clear cells. Looking at the picture here, you can see clear cells which are polygonal. Why they're clear? They're filled with lipids and carbohydrates, often golden yellow due to increase in lipid content. Looking at picture B, we can see it's a golden yellowish type of coloration to the RCC because of lipids. Lots of lipids in there. So what do we get out of this thing? They're polygonal clear cells. Why clear? Because they have a lot of lipids and carbohydrates, which also gives them yellow color. RCC originates from proximal convoluted tubule, PCT, which leads to you remember the PCT is the nearest structure that can go out and get to the renal vein. So from PCT, it's going to invade the renal vein, may develop varicocele if the left side. So why varicocele just on the left side? Because if you remember, the left renal vein drains the left gonadal vein. Okay, so if you were to obstruct a left renal vein here, guess what? The back pressure is going to go back and it's going to call varicocele. Okay, so left renal vein, varicocele on the left side, and then it can and eventually that left renal vein goes into the IVC, inferior vena cava. So that tumor can spread to even the IVC and can go to the lungs. When it goes to the lungs, it forms cannonball mets. It's called now the cannonball. You will see cannonball mets. Cannonball mets. So mets like this within the lungs. Okay, that's the cannonball mets, and goes to the bone as well. Now, RCC would manifest with flank pain, palpable mass because it's a mass, hematuria, which is a classical triad now. So flank pain, hematuria, and palpable mass, as well as anemia. Now these are the secondary things. Anemia, why anemia? Because you can't produce EPO, leading to anemia. Secondary polycythemia, less common, but can develop if you develop a lot of EPO, can develop polycythemia, cause fever, weight loss. Treatment is surgery, ablation for local disease, and immunotherapy, for example, ipilimumab, or targeted therapy for metastatic disease. It's rarely curative, resistant to radiation and chemotherapy. Okay, so RCC is the most common primary renal malignancy. Look at picture C here. You can see RCC here in the picture. Most common in males 50 to 70 years of age. Increased incidence with tobacco smoking and obesity. Associated with paraneoplastic syndromes. Very important. RCC increases the incidence. There's increased incidence with tobacco smoking, and it causes paraneoplastic syndromes. For example, it can cause PTHRP, which is PTH-related peptide. So when you have this, it's going to act like PTH, and it's going to cause lots of calcium in the body from the bone. So it's going to cause bone pains, lytic bone issues, lytic bone mets. due to the fact that we are getting calcium from the bones. Then you also can cause ectopic EPO, as they have mentioned here. If it was to release EPO, then it's going to cause polycythemia. ACTH. A lot of ACTH will cause Cushing syndrome. So this patient is going to present with anything. Renin would cause hypertension. And the mnemonic here is the pearl neoplastic. Okay, so that's all the paraneoplastic syndromes that can that are associated with RCC. Now, clear cells. This is the most common subtype associated with gene deletion on chromosome 3. It is sporadic, or could be sporadic, meaning it can be occurring in elderly, as they mentioned, 50 to 70 years, so sporadically comes. Or it could be inherited, meaning you can see the same thing in a young patient as von Hippel-Lindau syndrome. So a little bit going back to VHL, von Hippel-Lindau here. So what does the von Hippel-Lindau gene do? So VHL, von Hippel-Lindau gene, it normally, the VHL gene is there so that we can inhibit angiogenic growth factors. So remember, when we are making new tissues, we need the angiogenic growth factors, for example, VEGF and PDGF. But we need something that's going to inhibit it. So that's the VHL gene that would inhibit these vascular endothelial growth factors so that there is no more angiogenesis. But if we have a mutation now here, we cannot inhibit these anymore. So there is lots and lots of VEGF and PDGE, right? Or PDGFs. What's that going to lead to? That will cause tumor proliferation. Okay, so that's the background of VHL gene in the von Hippel-Lindau syndrome. RCC is 3 letters, so 3 chromosome 3 associated VHL. Okay, that's kind of a good way to remember. RCC 3 VHL 3 letters. Okay. So one of the other things that let me mention here, we talked about tobacco smoking, we talked about obesity, but there's another thing called toxic exposures from outside, which are, for example, from toxic exposures like, what toxic exposures? Like heavy metals and petroleum products. Also ethylene products can lead to increased risk of RCC. So ethylene, petroleum products, and heavy metals, they also increase the incidence of RCC. So that's pretty much all we have for RCC.